Encompass Health Rehab Hospital of Waco is rolling out a program to get their patients over the hurdles of their disabilities and injuries and back to completing tasks of daily life. It's called their Community Reintegration Program. 6 News' Mike Rogers spoke with patients in recovery about this big next step. Mike?
Yeah, Chris, I talked with program chair Kaylin Fleming, and she says near the end of a patient's time at Encompass, they take part in one-on-one outings like a trip to the grocery store or parking a car to integrate them with tasks of daily life. And patients I spoke with said that next step is not only what tells them about their physical limitations, but the mental hurdles they have left to come.
I'm going to be walking out of here before it's over with.
After a series of falls that landed Richard Parker in the hospital, he says his body is on the road to recovery.
We're doing therapy with our arms and weights. We just learned some new ones today, about stretching the band.
Along with his fellow patients, the activities room of Encompass Health Rehabilitation Hospital in Waco is full of patients working to regain their strength, mobility, and more.
A lot of our treatment is very wholesome and trying to find out what's important to that patient.
Encompass certified occupational therapy assistant Kaylin Fleming says in overcoming their physical ailments, the goal is to get their patients comfortable with functioning independently.
There it's different. You're meeting other people, you're having to navigate obstacles.
Fleming chairs Encompass's Community Reintegration Program for patients further on in their recovery, planning monthly activities like grocery shopping or dining out.
Anytime you interact with people, you're doing better.
Once the patients are stronger, moving, and have their cognitive boxes checked, they'll accompany a therapist out in Waco, working through the obstacles of life with a helping hand.
When you think about these things and how important they are for them to get out and be able to do by themselves and independently and safely, you kind of have to start troubleshooting what's going to work for them.
For Parker, he says it's a sense of normal he can't wait to experience.
This is the best hospital I've ever been in, and I mean that sincerely.
Now, in addition to those outings, Fleming says patients will also work on a list, strategizing an errands run, and what obstacles like curbs and parking lots may be present. Now, she says for the patients, it's a real-life setting to practice those skills. Chris?
Yeah, it's like a rebirth for them, a second chance. I love it. Mike Rogers reporting live tonight in studio. Great story. Thanks, Mike.